안녕하세요. Ciao. Ni hao. Hi, I'm Julia from Group 4, and we have a strong passion for equitable public health information for culturally and linguistically diverse communities in Australia. So that's what we decided to focus on today. Australia is one of the most ethically diverse countries in the world. This diversity is beautiful, but it presents significant challenges in a public emergency like the current pandemic. Our team focuses on the CALD community in Australia. We believe that advocating for equitable and timely access to public health information is vitally important. The culturally and linguistically diverse community has been identified as a vulnerable population. They're more likely to be in a lower socioeconomic status, above the age of 65, and tend to live with poorer social determinants of health. A Melbourne survey in April found that 22% of migrants did not understand or did not receive any COVID-19 information. So our proposal tackles two main areas of delivering public health information: timely and accurate information, and culturally appropriate solutions. There are several barriers to equitable health information. For example, only 10 languages other than English have been translated for reopening under COVID safe guidelines. Some materials appear to be translated but extremely poorly. In August, ABC News published several examples of official posters with non-meaningful translations in Arabic, Farsi, and Mandarin. Now imagine an elderly Chinese man who just learned how to use the internet. The Victorian government has released some new restrictions, but neighbors have been giving you contradicting information on what these restrictions are and how easy is it for you to access official information in Mandarin. If you were to Google how to prevent coronavirus, none of these top Google searches yields any Australian information. And the first Australian one you encounter does not pertain to local Victoria guidelines. So you call your grandson and he tells you to change your search terms to Melbourne restrictions. Well, the top link pertains to foreigners, not Australian residents. And that one link you cannot read, well, that's the official webpage that opens up to the information in your language. But you didn't know that because you can't read it at all. And lastly, there are many official looking non-English websites with so many misinformation. So our government recognizes issues and has a number of initiatives targeting them. There are increasing outreach efforts for media in local languages other than English, translating materials into 10 different languages. The government also engaged with multicultural media outlets. But Australia's multicultural communities are still missing out on vital COVID-19 information because dissemination of this information is not effective. Recent events highlighted these insufficiencies in both the recent bushfire and public housing tower lockdowns. These gaps are not new nor limited to Victoria. In 2014, a Queensland government report found that public health communications tend to be ad hoc rather than a planned workflow. We need to improve both the quality and reliability of public health communications in non-English language. Our suggestion is to redesign the current government websites. Particularly, the route to non-English resources need to be more apparent through non-English text on all relevant government websites so that English literacy is not required. Secondly, being fast is good, but not enough. We need to be precise, culturally sensitive, and ensure that we prioritize support to marginalized minority cultural groups, rather than generalizing experiences under the multiculturalism umbrella. For COVID-19, we have provided prioritized support, and the government invested $6.9 million in one task force, but there are 8 million multicultural Australians. This means we need a greater representation of permanent CALD members in advisory groups, partnerships between public service and multicultural organizations. We need tailored support to address unemployment, financial well-being, and social isolation. As detailed previously, our two-pronged approach will lead to measurable impact. So how will we change the world? Well, we'll establish permanent trusted communication channels between officials and CALD communities, integral for future public emergencies, address the multifaceted reasons for poor health outcomes, and as a result, benefit all Australians. The first step is to consult the communities to understand their specific concerns. Next, connect our existing multicultural organizations to government and each other. And finally, expand the service other minority groups. And this is our team. Coming from health science backgrounds and cultural groups themselves, we truly envisage a proposal to help our families, your families, and the millions of Australian families. So today, we ask you to take a moment to envisage our dreams with us. 26 million Australians receiving timely, appropriate healthcare and information. We are ready. Are you? Nice.
5 minutes and 40 seconds. Pretty good.
Yeah.
We
Pretty
hit 5 minutes at the first part of here, the first sentence on this one. So 5
For the
minutes
timer?
pretty much here.
Oh, at the impact.
Yeah.
Nice. That's actually pretty good.
Yeah, that's a good improvement.
Yeah. Because like I think it would be good if we can go to the timeline part, but that's still amazing.
Yeah.
Yeah.